And once again, we have Mr. Marcos Mejia, who comes from the county of Sonoma. And Mr. Mejia has been coming to KBBF and Líderes del Futuro for the last almost a year now, maybe a little bit longer. And before that, we had one of your colleagues, and before that, we had somebody else. It's being, we are now on year 3 of COVID. And so thank you for taking the time being with us. I want to start before you give us your weekly report. I want to just remind the community we need to stop believing that tomorrow something magical is going to happen and COVID is going to disappear. We need to come to the realization that COVID is here to stay, just like the flu, and that we, from time to time, we'll have to get a new booster. In order to take these masks off, we all need to get vaccinated. And I think that part of the community that chooses not to get vaccinated is just because they think, well, if I just wait it out, it'll disappear and we're all going to be okay. And that's absolutely not how these things work. And with that, I want to thank you for being here. Senor Mejia, please give us all the information that you have for us.
Thank you, Rafael. Thank you for having me here. I want to first share some good news about vaccines with you. More than 40% of our children ages 5 to 11 have received at least one dose of the vaccine, and 1 in 4 are already fully vaccinated. 78.2% of the eligible population 5 years and older are fully vaccinated, and another 8.1% have at least one dose. 56.4% of the population aged 12 and over are already boosted. We applaud and thank all the parents and children who have taken these important steps. 2 more good news are that now we can all request 4 free rapid tests from the federal government. Delivery will take 7 to 12 days to arrive. The website for processing application is covidtest.gov. It's active now and is taking orders. Each household will be limited to 4 free tests. The Postal Service will handle shipping and delivery via first-class mail. Free testing will also be available to some community health centers, rural clinics, and federal testing sites. The other good news is that the federal government will provide 400 million N95 masks to residents for free starting next week. The N95 respirators, so named because they can filter 95% of all airborne particles when worn correctly. According to the CDC's new description of masks, well-fitting respirators, including N95s, offer the highest level of protection. The mask will be available for pickup at pharmacies and community health centers across the country. They will begin shipping this week for distribution beginning late next week, according to the White House. That said, now a review of where we are now. We are at a critical time in the pandemic as new cases continue to rise, fueled by the Omicron variant, posing a serious threat to the capacities of our local hospitals and other healthcare facilities. Our new case rates are reaching levels that we have not experienced in the 2 years of this pandemic. A month ago, we averaged 90 new cases per day. We're now averaging over 1,250 new cases per day, 1,250 new cases per day. Over the past 2 weeks, Sonoma County had the 3rd highest percentage increase in hospitalizations of the 58 counties in the state. This is according to the New York Times. Hospitalizations for COVID-19 have more than tripled in the last 2 weeks, increasing from 7-day average of 27 to now 88 patients average per week. And more than 30% of them are ICU patients that are COVID positive, of course, and unvaccinated. There are currently more than 100 people hospitalized, the highest level for a year. Our 6 hospitals in Sonoma County are under pressure. And because of this situation, 8 days ago, we asked residents to stay home as much as possible for 30 days. We also asked that you limit your interactions with those outside of your immediate family. We continue to recommend that we all limit our outings to work or school or the grocery store or the doctor, but nothing else, just to the minimum. Also, Dr. Sundari Mays, the health officer of the county, issued a health order last week, canceling large gatherings to prevent further spread of the Omicron in the county. This includes large gathering of more than 50 people indoors or more than 100 persons outdoors, where social distancing cannot be respected. The order is scheduled to remain in operation until next February 11th. The reason we are focused on limiting large gathering is because that's where more than 50% of the positive cases are originating in large gathering. These steps were taken to protect the community, support equity in the county, and preserve the ability of our hospitals to serve the COVID-related and non-COVID-related medical needs for our community. In the last 60 days, school-aged children ages 5 to 17 were the largest group of cases in Sonoma County, with 20% of the cases in the last 2 months. Higher case rates are again occurring among communities of colors, essential workers, and residents with less access to resources to support their health. Latino residents are experiencing the highest rates of cases, with 272 new cases per day out of 100,000 persons. The Latinx community has experienced more cumulative cases than any other racial ethnic group and has consistently been overrepresented in hospitals and its hospitalizations and death. In 2020, the life expectancy decreased by 2.1 years among Latino residents in Sonoma County, compared with 0.7 years among non-Hispanic white residents. The drug overdose death rate increased by more than 200% among Latino residents, compared with 77% increase among non-Hispanic white residents. Latino residents were also the only racial ethnic group to experience significantly higher than expected suicide deaths in 2020 compared with the average of the previous 3 years. Life expectancy and death analysis for the 2021 are still pending completion of forensic reports. Reducing the spread is essential to mitigating further medical, mental, or economic harm to low-income communities of color, as it has been through the pandemic. The Omicron variant may be milder than other variants like the Delta, but if you are not vaccinated, you are still 17 times more likely to end up in the hospital if you can catch it. We ask that you go to socoemergency.org/vaccine for more information on the vaccine, and please visit scoe.org/vaccines to learn more about SCO's immunization clinics and the reopenings of schools. And that's my report for today, Rafael.
Definitely, I want to thank you. And again, the question that we had was in general, what happens if the family has more than 4 people who live there and the federal government is only sending 4 rapid COVID tests? What other alternatives will the community have?
Right. So for now, from the federal government, it's only 4 antigen tests, all free for households. So it doesn't matter how many persons live in the household. That number can be insufficient completely. So another couple of alternatives. I was mentioning in my report that the community centers will have also tests available, but that means that you have to belong to have a medical home at any of these community health. Or for those that already have it and have insurance, they also have the option to be reimbursed for up to 8 tests per person that is insured. So that gives another possibilities to get more tests. And the other alternative is to do still those long lines, like you can go to the Roseland Clinic or to the one in Rodney Park, and the tests are for free, but the lines are long. This while supplies don't increase. We are expecting that may lessen a little bit along the end of this month and probably through February. But tests are going to continue in demand as we have all this ordinance also in place for workers to be tested not only once, but twice per week. So imagine the volume of tests. So in the meantime, while we have these enormous numbers of Omicron, my suggestion is that we stay at home. That's the best way that we can prevent an infection. There's a lot of talk out there that, well, this is your chance to gain natural immunity if you catch the infection with Omicron. But you know what? That's gambling really serious with your own health. We hear more and more cases. Now it's over the 10% of long COVID cases in general. Imagine that almost 10% of people infected with COVID gets the long-term COVID symptoms.
Yeah.
And I want to ask our audience, is that worth it? Is that something that you want to risk to achieve your immunity versus maybe 2 more weeks minimizing staying at home? It's not an order this time, it's a strong suggestion, but that's your way to contribute to yourself, to preserve your health and to preserve yourself for those that you love, and to give back to your community so everyone stays healthy and we all can someday remove masks and just go out as much as possible to the way it was. It's true that mental health is a big issue, and it will continue to increase because it's been 2 years of this. And we are seeing in my report, I was mentioning also this horrendous trend of suicidal tendencies, especially in teenagers and in teenager girls. And this is really sad. So let's all do our part. Let's take care of ourselves. And that way we can preserve our family and preserve our society going and moving forward.
Definitely. So in the Latinx community, we need to be more honest. We need to talk about our mental health. We need to check in with our children. There are children that are spending 6-7 hours after school just in the rooms. We don't know if they are self-medicating through marijuana or other drugs, or they're just simply sleeping for hours and hours, which is completely unhealthy. So hopefully, I know I will be able to do another segment later today in Spanish about mental health. But if we have time, we'll also do the same segment in English. With that, I know you have to go and I have another interview. So I want to thank you for always taking the time, dedicating the time, getting the information to our community. And I look forward to our next conversation. Thank you.
I'll be here next week. Thank you.